Discussing about how to plan out our research that will focus mostly on the survey. Let me change the pen first. So when we are planning for the survey, the topic that we are assuming, we are still not confirmed with the topic, we are just assuming that how we can plan the survey based on our topic, which is the SDF, where we were comparing in the clinical trials the traditional SDF, silver diamine fluoride, with the colored or tinted blue SDF. So when we were comparing this in the clinical trial, now for the same, if we need to do a survey, hope the screen is clear. Now for the same, if we are doing a survey, so we should be focusing on the clinicians. So it would be like the clinicians survey. So whom you can target over here is the pediatric dental professionals, and what we could test over here is the ease of application. So this would be framing your first question, that is the ease of application. So what you are asking from the clinicians is that the pediatric dental professionals, that you are asking is the ease of application. So after each procedure, the participants, that is these, the pediatric dental professionals, should complete this visual analog scale, and the instructions that they should be following is that you could provide them the instructions that please mark a point. The first point, we are asking these dental professionals that please mark a point on line of 0 to 10. This is 0 to 10 line that best represents your experience during application. Okay, so 0 to 10 is your ask from the pediatric dental specialist that mark the points following the questions that you are putting forward. So the question 1 would be visibility of material, that is how much this material was visible, how easy it was to see the SDF on the tooth surface, this visibility on tooth surface when the application was being done. And what type of SDF we are using in this clinical survey is the blue tinted one, that is the colored SDF. So we may provide them the colored SDF, or we may ask them to have a blue colored SDF by themselves if they are practicing pediatric dentistry, or the SDF that they are using. So visibility of the material on the tooth surface during application, 0 over here would mean it was invisible or difficult to see The 10 would be, it was high contrast and or very clear. So on the ease of application, the first thing was visibility of material. So it was invisible, that is difficult to see, or a 10 scored at high contrast, very clear. The questions that you ask, and they could mark 0 or 10, easy, one question done. Second would be the control of margin. So control of margin means that you can ask how I am writing it this, so that it is always there in the video section, so that once we are offline also you could easily find the information. So how confident you were, this is you are putting a question to a dentist, how confident you were that material stayed within the cavitated lesion. So this is the second question you are going to ask. So if the score is 0, that means it was poor control, that is the dentist was not able to see whether the material was within the margins or whether it overflowed. And over here the 10 score would indicate there was precise control, that is the dentist was able to see, the pediatric dentist was able to see the margins were controlled, were defined, well defined within the cavity. If this is the tooth, this is the tooth, and this over here is a cavitated lesion. So the margins of this SDF application were clear that it was not overflowing, it was restricted to this cavitated lesion. The third question that you can put forward is procedural stress. And by mean of procedural stress, we mean that rate your own level of stress regarding accidental staining of child's gingiva or lips or even cheeks sometimes, that we touch with the same finger the applicator brush tip and the cheeks to relax the child, to control the child. So sometimes the cheeks get stained also. So over here 0 would mean very stressed during application as you were worried about the staining of the areas. 10 would mean completely relaxed as you were in control because of the color of the SDF. So this is the thing that you need to understand. The third question. Now coming to the fourth question. So the fourth, you can ask the patient, the dentist, efficiency of the product, that is you can ask them, did the color of material help you complete the application faster? whether if you were previously using the colorless SDF and this colored SDF, does it help you complete the application faster? So the response can be either in yes format or no format. Okay, so these are the things that you should be asking the patients, the pediatric dentist regarding, and there could be a lot of questions. This is just an example on how the questionnaires can be. So these 4 questions that you can demarcate. The fifth point that you can consider is comparing the based on this ease of application that we are discussing, as we are comparing the ease of application in the survey. So the fourth would be which SDF were you able to easily find in the usage? So SDF, the traditional one or the colored one, based on ease of application. So they could reply whether the traditional one or the colored one. This could be your fifth question. So like this you can frame the questions based on the ease of application that we decided. Again, you would have to provide the parental consent template for the pediatric dentist to help them out. And what it would mean is that you could name it as blue tint, this as a template clause, and you can be sure that since you are using a colored variant, it is vital to manage expectations, because the parents might ask that something color is being added. So there could be the questions from the parents as why a blue tooth would appear and then it would turn to black. So initially the tooth would appear blue and then it may turn black within 24 hours. So this is the information that you need to provide, the pediatric dentist needs to provide to the parents. So this you have to provide to the pediatric dentist. The other information that you need to consider is the study procedure. For example, you have to tell the parents that your child will receive the liquid. Your child will receive a liquid. In the simpler terms, liquid, this is SDF, which is liquid to stop, in the layman terms, to stop cavities from growing. And the third information you are providing is we use tinted blue variant of this medicine. So now the questionnaire for the parents would be, this would be the continuation of this, the 5 questions from here, the 2 or 3 questions over here that you may ask the parents which have come to the pediatric dentist. Why the color? So the blue tint will help the dentist to see exactly where the medicine is going, ensuring it doesn't touch the gums or lips. So it would be their ease of application. The second would be what to expect. So basically the tooth may look blue initially, and later on it will in 24 hours turn black, and when it turns black, this shows that the medicine is working. This is for the parents. So the color, why the color, what to expect, these are the information that you are providing in the template. So let us take another paper. before we finish it up the things. And on the basis of this, we are measuring the anxiety. And how we are measuring the anxiety is, this is to make your anxiety reduction data more scientific. So what would we recommend is modified child dental anxiety scale, that is MC dash, this along with pain scale, or the Facius scale that we follow, the face scale that depicts the different expressions on the procedures for the child. So what type of anxiety we are going to measure over here, we will write the anxiety that we are going to measure, the time to measure that anxiety, time of measurement or assessment we can say, and what could be the target. So the first anxiety is the baseline anxiety. And by baseline anxiety we mean the pre-operative we are measuring over here, the time of assessment when the child has not come, the pre-operative. This is based on these scales, dental anxiety scale and the Facius scale, just enough that we can provide to the pediatric dentist in the waiting room. So this would, what it would assess is the child's general state. Okay, the second would be the anticipatory anxiety. And by anticipatory anxiety we are measuring this upon seeing SDF bottle. You are just going to show the SDF bottle to the child or the applicator brush which you are going to use, and see the child's reaction to that tool, the bottle or the brush. This on the basis of these scales you are just going to tick those things. The third thing is the procedural anxiety, and by procedural anxiety we mean during 60 seconds application, and by 60 seconds application we are measuring the heart rate, and heart rate can be easily measured with the help of pulse oximeter. So over here we are going to use the pulse oximeter that pediatric dentist. And the fourth thing is the post operative relief. So 5 minutes after procedure you have to assess the child's memory of the event. So all these things as a template must be provided to the pediatric dentist to get this data also from the parents. apart from the ease of application in your survey. So you are basically targeting two things: the clinician's performance on the basis of the ease of application, and the parental consent and the anxiety level reduction. So this survey would be dual, where you are getting the information from both the aspects, the child as well as the pediatric dentist. Hope the things were clear for this point of time regarding the survey that we can plan out for this particular example. That we can, many more questions can be added, questions can be modified, so all these things can be collected, and the data that we are going to collect, that is on the basis of this, the special parameters like the anxiety scales and faces scale should be measured, and all these things would be assessed. So next we can plan out how many questionnaires can be put on, or how many dentists can be considered, what could be the clinical protocol, and the data collection sheets how can be fabricated. So all these things would be covered up when we plan out the topic that we have finalized. So hope the things were clear in easy understanding way for the survey that we were discussing. Let's meet on the Zoom for other discussion beyond this. Hope the things were clear over here. Thanks for watching. Bye bye.